yon respectively. Reports were made po, however, the funds for meals, transportation, and accommodation were downloaded to hospitals in December 2020. But were asked by DOH to return the funds. To return the funds almost immediately, within the same month, according to Alliance of Health Workers. Please correct me if I'm wrong. No? So ang question ko, how much of the then unutilized funds were returned by the recipient hospitals to DOH, and where were they reallocated, Your Honor, Secretary?
I think they were
Excuse me,
repurposed.
just a moment, just a moment.
Right?
Senator Villanueva, this is you have to wrap up now, okay?
Yes, sir. Yes, sir.
Mr. Chairman, my apologies. I don't have the figures, the exact, but I can just, with your permission, Mr. Chairman, submit a report on this today, Mr. Chairman.
Siguro ang sagutin na lang, Secretary, what were the working estimates? But we will wait for that report. What were the working estimates of DOH at the time, and why the funds had to be repurposed? Repurposed, yeah. Bakit?
With the permission of the chair, again, my apologies, no, because it's a bit specific. Can I ask Director Laura, to be recognized? Director Laura, please.
Just make it quick.
Yes, good afternoon, Your Honor. Regarding po sa repurposing po ng funds ng mga natira noong December, we believe at the time that we issued the memo requesting for our operating units to for any funds that they may no longer be utilized, na maibalik po sana sa Department of Health. But hindi po kami naghingi ng any amount. Ang sinabi lang po dun sa memo is kung hindi na kailangan, that we believe na nakapagbayad na sila, nakapag-satisfy na po ng mga benefits ng, especially benefits ng health workers, na maibalik sana sa Department of Health. Why? Kasi po at that time, mayroon pa pong mga iba po talagang clamor na dagdagan yung sa meals, dagdagan yung sa SRA and sa hazard. Para rin po ma-download din po namin agad-agad yung ibang pangangailangan. At the
Do you
same
have a
time,
ballpark figure how much it is?
around 1 billion, sir. It's roughly
Well,
around 1 billion.
yes, I know my time is up, so let me just say, Mr. Chair, and spread into the record that it boggles our minds how the funds allotted for SRA and hazard pay benefits adjusted and reallocated to another set of benefits for meals, transportation, and allowances. But in the end, Mr. Chairman, our healthcare workers did not get either. So DOH should trace these funds and see which regional offices and or hospitals still hold these funds and make them accountable. So yun lang ho yung gusto nating bigyan din. And again, nandito tayo para tulungan ang lahat na magkaroon ng clarity and transparency, and at the end of the day, magkaroon ng pananagutan, accountability, tayong lahat bilang mga miyembro ng kawani ng pamahalaan. Muli, maraming salamat, Mr. Chairman. Thank you sa ating mga resource persons.
Thank you, Senator Villanueva. The points were well made, and just a follow-up, mabilis lang. Secretary Duque, kaya kayo nahihirapan sa tracing, hindi ba? Unlike Singapore, like Hong Kong, unlike other countries, meron na silang single monitoring ng tracing. Di ba? Eh dito, lahat ng local governments may kanya-kanyang tracing scheme. Tama ba yan?
Tama po yan. Meron pong kanya-kanya, but the DICT is working with them now to as a platform for interoperability of the contact tracing applications.
And because of that, the cost of inefficient contact tracing is probably staggering in the form of one life too many, correct?
Yes, Your Honor, you are correct.
Kaya nga dapat, an effort must be made by the government doon talaga magkaroon lang ng single tracing sting. Kung ba, my daughter is in Hong Kong, they work there. Pag pumasok ka sa isang, kung malalaman kung ikaw nagkaroon ng COVID o may mga COVID doon, masasabi ka agad at tatawagan ka agad. Kung ikaw ay pumasok at tatawagan ka agad ng health system. That is the kind of health system we want to have. Di ba? Para malalaman
Yes,
natin
sir.
lahat.
Yes, sir. Meron tayong stay safe. This has already been adopted by the IATF and has been recognized as the national government contact tracing application. But work goes on in integrating the other systems. I understand here in NCR has been where the efforts for integration have been started. But let me just check on that,
Sorry,
Mr.
I can't
Chairman.
agree with you because to my mind, that is, as you say, the weakest point, the weakest link. So, importante yan, I prioritize ng the guardian of health in our country, which is your department under your leadership, na dapat malinaw na pagka isa lang ang system natin, malalaman natin kagad kung sino ang tinamaan at sino ang pwedeng nagkakalat, hindi ba?
Yes,
So,
sir.
importante yan. Importante yan. So, I would advise you na dapat yan ang bilisan natin talaga.
Yes, sir.
Sapagkat kung meron na gamit, sorry, isa lang ang gagamitin natin para malalaman natin ang tunay, ang punot dulo. Because ang sasabi ngayon, understated yung ating may tama. Ano, isang araw nagdi-debate kami diyan yun lang sa testing Sabi ko understated at sabi ng iba mag-concentrate na lang tayo sa vaccine. Hindi pwede sapagkat malalaman ba natin na nagkaroon ng 18,000 na tao na may tama ng COVID kung hindi tayo nagte-test? Paano niyo malalaman may tama kung di mo tinetest? Tama po ba 'yan?
Yes, Your Honor.
Oh. Alam kong isuya ka na, nakikita ko sa mukha mo suya ka na hindi maintindihan
I'm
ng
not,
tao.
sir. I'm not.
Medyo pipinturahan ko ng konti yung ngiti mo, parang ngumiti ka. That's the problem kailangan logical tayo, kailangan malinaw tayo. Katulad nung, libre talaga yan testing. Kaya lang nilimit lang natin para hindi magkapatong-patong. Katulad ng vaccine, libre yan. Para hindi magkapatong-patong, sinabi natin, mga doktor muna, yung mga frontliner muna, senior citizens, para may prioritization. Yun ang kailangan mapaliwanag sa tao. Dahil pagka ganyan, sasabihin lang mahal. Anong mahal? Ang nagbabayad nga PhilHealth Dapat PhilHealth ang magbabayad yan talaga Nasa kanyan Kaya nga, may tungkulin din ng tao na magbayad din ng kanilang tinatawag na membership sa PhilHealth para lumawak, para talagang maproteksyonan tayo. Tama po ba yun?
Yes, Your Honor.
Pareho yan SSS, GSIS, PhilHealth is based, what you put in is what you get. If you otherwise, para civil minimums lang tayo, hindi kakasya lahat yan, bibigay mo sa lahat, walang matitira sa tao. Finally, talin ko lang yung si Laura again, yung COA, sinabi na nga ng COA Secretary. Again, I reiterate, ang sabi ko nga, risk-taking on the part of the Secretary of Health, na sinabi na nga na dynamic ang system, ang proseso. Lumilipad na ngayon yung variant. You can get it in the air. Kaya dapat yung sinasabing directly catering to or in contact with COVID-19 patients, dapat interpret yan sa liberal interpretation. Pero dapat talaga, tumaya ka at ito, pinipilit ko na yung mga staff ko, gumawa na ng batas na gustong mong mangyari. Pero dapat, ma-assure natin ang public na kailangan, ang interpretation yan malinaw na tutulungan sila ng ating gobyerno sapagkat pagka nauna na ng gana yung mga nurses natin o yung mga healthcare workers natin, patay-patay tayo. I will now recognize Senator Marcos, please.
Thank you very much, Mr. Chair. And I'm very pleased to be here. Of course, we're all very, very worried about the nightmare scenario of a mass resignation of our healthcare workers and at the same time, a national shutdown of our hospitals. So because of this, I would like to inquire, wondering why am are you hearing an echo po?
I am.
Yes, I'm wondering where it's coming from Yes.
Can we trace kung sino yung nakabukas? May nakabukas
There was another meeting kanina baka that's the one that's doing it. In any case, I would like to call on COA and the DBM to discuss the issues because ang pinaka-interest natin talagang makahanap ng pera para mabayaran yung SRA at hazard pay ng ating mga medical workers. And there seems to be some kind of discrepancy among the funds, some kind of disagreement also with regard to policy. So I'm trying to think, does the administrator have me on moderated unmute mode? Baka yun ang echo. Admin, please.
Will the admin please check kung bakit may echo? Baka meron kang katabing computer dyan, Senator Amy.
Ayan nga eh.
Nakabukas. Yan. Try again, please.
Is that any better? Ay nako,
No,
may
hindi
alimuhan
pa
pa
rin.
rin.
What are you saying?
Yes, sorry. In any case, let me just proceed, no? And I thank the COA for answering very promptly to Chairman Michael Aguinaldo, as well as the DBM, although kanina nga lang binigay, dahil sabi nga ni Yusek Tina, na kinukumpuni pa niya yung mga figures. Yung DOH na obliga ako na isole kasi hindi magtugma-tugma. Ngunit, eto nga, ang klaro is there is money. As of June 30, may 61 million more or less from Bayanihan 1, may 7 billion more or less from Bayanihan 2. Meron ring mga pera galing sa GAA 2020 and of course, andyan pa rin yung 2021. My question is that COA issued in the letter to myself as well as Senator Angara the opinion that the reversion of these funds to the DBM extended the validity of Bayanihan 2 up to June 30, 2021. Ibig sabihin, after June 30, 2021, nag-lapse na yung mga pondong to, wala nang pambayad ng SRA. Medyo nakakatakot to. Ito rin yung opinion ni Yusek Tina Kanda dyan sa DBM na nag-lapse na to kaya magre-revert. Wala na tayong perang pagkukunan for the SRA. On the other hand, under the GAA, by extending the availability of the said APRO up to December 31 of this year, may unobligated pa under FY 2020 GAA. So ang tanong ko, I'd like to know ano yung opinion ng DBM. Kailangan ba talaga i-revert yan? Katulad ng sinasabi ng COA sa sulat sa akin. So I'd like to ask Yusek Tina as well as Chairman Aguinaldo if he's still there. Yusek Tina, you look well. I hope it's not true na nag-positive test kayo.
Nag-positive naman po. Pero at symptomatic so far. So I hope it continues. But anyway, ma'am, Your Honor, Mr. Chair, the amount under Bayanihan 2 has actually reverted. But we were able to finance the SRA for the 20,000 healthcare workers whose claims have not been paid under the Bayanihan 2 law. And we released it today. And DOH will be downloading it, I would assume, starting this afternoon.
Oh, so you were able to find some money. Is there any other funding left over that, as you know, needs to be paid out? It's much more than a mere 20,000 healthcare workers.
Actually, ma'am, we got it from the MPBF for healthcare workers coming from the government. And for those coming from the private sector, we cannot classify it as a personal benefit. So we actually tapped it from the unprogrammed fund. No, there is a funding backup coming from excess revenues as certified by the Treasury. May natira pa ho. So nasa ama ho po 'yon sa release. The total amount that was released today was 311 million pesos.
Okay, what is left over para mapangako naman natin sa ating mga health workers so they have something to look forward to?
Ma'am, we need to know from DOH how much claims pa they would submit because at this point, I think they only have a figure corresponding to potential claims. So, kailangan po yun,
Kasi
meron.
wala silang kompletong listahan ng utang natin eh.
Hindi ngayon po yata, they're actually consolidating the claims coming from hospitals, private and public, private and government. So we're awaiting that list in the event that the 311 million pesos is insufficient.
Yes, in the opinion of DBM Sec Abuel, as well as the letter of Chairman Aguinaldo from COA, yung GAA 2020, available pa yan hanggang December 31, 2021. Magkano pa bang natitira dyan?
Wala po ako ng figures ng buo, pero I can submit, ma'am, to you, to your office, the amount for continuing.
So that's clearly available, ano? Wala tayong problema dyan. And then of course, ongoing pa rin yung GAA 2021.
Yes, ma'am.
Ang maliwanag na pera. Hindi natin pwedeng sabihin na walang pera.
Opo.
So, maaari tayong mangako na bababayaran yung SRA ng ating healthcare workers as well as, is this correct ba, sa DOH at sa ating DBM, yung MAT, ADHP at yung iba pang owing sa kanila?
Yung ma'am, MAT, based dun sa approval na nakita ko, it's not supposed to be provided any additional release, but it will have to be taken from the budget of DOH. So it has to be charged against the savings of DOH. So wala pong release doon. Ang meron pong nakabinbin pa sa amin at this point will be the payment for yung sa mga tawag nilang vaccinators at saka yung mga ibang mga HRH, yung Human Resource for Health Sector, meron po kong unpaid doon na, as mentioned kanina ni Secretary Duque, is around 3.6 billion pesos.
That's right. So, may pera talaga. Yun nga ang itatanong ko. So, kung pwede ma-update tayo sa GAA 2020, tapos yung sa vaccinators at yung mga so-called mako-convert sa savings. Itatanong ko lang kay Chairman Aguinaldo kasi nariyan na rin siya. Tama po ba ito dito sa page 2 ng inyong sulat sa number 4? You stated that the unobligated sums of GAA 2020 are now extended up to December 31, but bayanihan 2, all the sums therein that have been unobligated of June 30 of this year need to be reverted to the National Treasury as they have already lapsed.
Good afternoon, Chair. Yes po, that's our understanding. Yung GAA 2020 po was extended for another year. Pero yung sa bayanihan po, I think nag-lapse po siya noong June 30, 2021. So kung hindi pa po na-obligate, normally nire-revert po talaga yon.
Are we saying that we will also revert all the massive sums that remain with the GFI sa Land Bank, sa BBP, sa Field Guarantee, katapos yung malalaking halagarin na nananatili pa rin sa ating mga LGU, magre-revert lahat yan?
Well, that's the concept there. Kung hindi pa po na-obligate, ang effect po nun dapat i-revert po sa Treasury. And it would be up to Congress to again appropriate the amounts.
Yes, that's a concern because I think the DBM as well as Senate LDRMO have different opinions on the same, and I urge you to come to a common policy so that this will no longer be another cause for delay and frustration for our healthcare workers. Kasi iba yung kanila eh. Sa kanila ongoing pa rin daw while the pandemic persists and the President has not withdrawn his executive order.
Opo, Mr. Chair, I think this is something that can be discussed with DBM po to firm up the policy. Ito po yung magiging observation po namin. But then if we can be convinced otherwise, we're very open naman po.
Thank you very much. I know the chair is always open to all sorts of opinions, and certainly given the sad state of affairs, we need to pay our healthcare workers ASAP. Thank you very much to both USEC as well as Chairman Aguinaldo. Nais kong tawagin ang ating PhilHealth.
Chair, can we just let Senator Amy know that there's an echo para lang marinig siya ng maayos yung iba? I think you might have another gadget open nearby.
I
Yes,
wish I had the capability to do that, but we should cancel the contract with whoever is running this this operation. Will the admin please take note that there are echoes?
ayun, nawala na. Nawala na kay
Meron pa.
Senator Gordon. Sa akin na lang.
Meron pa. Meron pa konti sa'yo, Amy. Baka sa iyo eh. Tingnan natin. No?
Oo nga, pinapatay ko na lahat ng gamit dito.
Can
Okay.
everybody please check whether you are open? Pakisara nyo muna i-mute nyo muna yung sarili nyo. Thank you.
Okay, tatawagin ko lang sana yung PhilHealth Legal. Yung OIC ni Attorney Del Rosario po. Please introduce yourself, Mr. Chair. Sino
Good
po
afternoon,
yung
Mr. Good afternoon, Mr. Chair.
pangalan
Attorney, Attorney Jose Mari F. Tolentino, Office of the Senior Vice President for Legal Sector, Mr. Chair.
Office of the Senior Vice President, saan?
Legal Sector of the PhilHealth, Mr. Chair.
PhilHealth po.
Yung legal sector ng PhilHealth. So you with PhilHealth.
Yes, Mr. Chair.
Haba naman ang title mo, Office of the Senior Vice President for Legal. Ang dami naman. Okay, so you're from PhilHealth. Go ahead.
Yes, Mr. Chair. As early as May, this discussion occurred already regarding the circular of PhilHealth as early as 2016, initiating investigations against false claims and suspensions on a broad scale of hospitals and other health facilities. So I flagged this to PhilHealth as early as June 11 kasi yung number of allegedly false claims lumobo from December to August of this year. Naging 15,000 na yung allegedly false claims. Nagtataka ako, mahigit kumulang lang naman 850 ang ospital. Ang dami-dami naman false claims bigla. Maraming nagre-reklamo and I know that Cebu Hospitals, Perpetual Succor, Chongpa, Adventist, all complained about this because they were immediately suspended for all sorts of payments. Tinanong ko ngayon yung PhilHealth Legal, yung arbitration office, 86 billion ang utang sa iba't ibang ospital. Pero yung fine na pinapataw ng ating PhilHealth Legal ay nasa 640,000 lamang. Magsha-shutdown ang lahat ng ospital dahil sa fine na pagkaliit-liit, samantalang yung utang bilyon-bilyon. Tama ba yun?
Mr. Chair, if the good senator refers to cases filed before the arbitration department, Madam Chair, unfortunately, it's not under the legal sector, Madam Chair. It's with the Office of the COO. So, ang sa legal sector po, from the fact-finding, investigation, and enforcement department, hanggang prosecution level lang po. Pag may finding na po ng prima facie case, tsaka pa lang po magfa-file ng formal complaint before the arbitration department. Yung arbitration, ang adjudication department na po ang pangalan niya ngayon, sila po ang nagre-resolve at nagpapataw ng kaukulang penalties, including fine, Mr. Chair.
Yes, but Attorney Tolentino, tama po ba yung sinasabi na while there's a disagreement between PhilHealth and the various health facilities, sigurado na talagang bilyon-bilyon ang utang natin sa ospital, hindi po ba?
Ma'am, I cannot confirm nor deny that the figures, Madam Chair, maybe the appropriate department who are with us, Madam Chair, because those are money matters, Madam Chair.
Okay. Let's go back to your quasi-judicial power then. Is it a fact that when you investigate, you also have the power to suspend?
Suspend the accreditation, Madam Chair, or are we talking about the suspension of payment of claims, the more recent?
All payments of all claims.
Yes, Madam Chair. With the
During during this whole period of COVID, we're fully aware that pneumonia was first discovered, and later on, nagne-negative sa napaka-primitive na COVID test at that time. So they were all considered fake claims, when in fact, it was just the lack of knowledge and experience with COVID-19. Hindi po ba ganun yung mga kaso sa tatlong ospital ng Cebu at napakarami pang ospital?
Yes, yes, Mr. Chair, may mga ganyang kaso po. For us in the legal sector, yung mga claims po kasi, pinoprocess muna sa mga regions. Minomonitor po yan. Our HCP pass, yung Performance Assessment System, and the MIDAS, ito yung parang IT namin, makikita po doon kung may mga red flag na mga claims. Ngayon, iipunin po siguro yan, and kung sa tingin nila may reason for the legal sector to conduct a fact-finding investigation, doon pa lang po magsisimula ang proseso pangangalap ng mas marami pang impormasyon para makita natin doon sa investigation report kung talaga pong may claims na dapat irekomenda. Irerekomenda pa lang naman po ng fact-finding yon kung necessary na isususpend yung particular
What is the
claims.
status of the alleged 86 billion claims of all the different hospitals? Anong status nila? Kasi ang dami-dami sa sinasabi na talagang magsususpenso kayo kahit you deny that this was a new circular, and that in fact, this circular was 2016 pa. Ano ba talagang mangyayari dito sa utang natin sa ospital? Acknowledge naman ng lahat na yung utang eh. Tapos, kinakasuhan pa ninyo. Ano ba talaga ang balak natin?
Madam Chair, as to the payment of claims, I'm sure I'm definite that pinoproseso naman po yung mga good claims. Talagang pag nakitang good yan, binabayaran po agad.
Your office has jacked up the numbers. From 9,000, it's now 15,000. Apakadami na nito. Parang sinasadya na eh, pagkarami-rami naman. Kung sa bagay, dati-dati, ang tawag namin dyan sa mga false claims, livelihood.
Well, Madam Chair, we only act upon the reports. Kunyari may natatag sila na tingin ng
What do you
ano
ascribe
natin.
the sudden multiplication of all these claims? So what do you ascribe this huge increase?
Ng fraudulent claims, Madam Chair?
Bakit napakarami biglang lahat fraudulent?
I think I would attribute it also to the increase talaga ng number of claims ngayong panahon ng pandemic. I think our IT also can sila po kasi nagagather ng lahat ng ng claims together with our PhilHealth regional offices. Ngayon po kami sa legal sector, we act only upon kunyari may recommendation o imbestigahan po itong particular kasi parang tumataas yata yung parang nakakapagtaka bakit nagki-claim pa sila ng ganito karami. And then the investigation begins.
Isa't kalahating taon na tayo nagdudusa sa COVID. Hindi naman nakakagulat yun. Talagang dapat mag-claim.
That is correct. I agree with that, Mr. Chair.
Eh, yung pala yun.
Yung claims po. Yung claims po.
What we can do, this investigation, after all, under the Blue Ribbon Committee of my chairman, Chairman Gordon, is in aid of legislation. Masasabi ba natin na may abuse of the overarching and extremely broad and encompassing quasi-judicial powers ng PhilHealth Legal? Unlike NLRC, halimbawa, LTFRB, ang lawak-lawak eh. Kayo na ang mag-iimbestiga, kayo ang magsususpend ng payment, ultimately, kayo rin ang mag-decision na magbayad.
I would say, Madam Chair, Mr. Chair, na in the present organizational structure ng legal sector, as regards filing of cases, I would say it is very efficient and effective, Because we start with fact-finding
Well,
muna.
the opinion of the
We don't.
hospitals, including the medical workers and the private hospitals, is that it's in fact abusive.
Mr. Chair, we make
Cost
sure that
efficient and effective.
we ensure that due process and all the rights of our stakeholders are respected and observed, Mr. Chair.
Sige, ganito na lang. Maybe you can give me a breakdown of the claims in the past 2 years at saka yung mga ospital, isubmit mo sa ating chairman. Okay?
Mr. Chair, clarify ko po, claims po ba or cases?
Hindi yung claimants na lang na sinasabi ninyong false claimants. Para bigyan na natin ng pagkakataon o ikaya, ibukod na lang yan. Tapos yung mga hindi naman false claimants, bayaran na.
Yes, Mr. Chair, we will coordinate with with our departments na in charge with those claims processing.
That's right. Kasi iba-iba ang listahan hindi magkaisa
Senator Marcos, please wrap up.
Yes, thank you very much. I would just like to...
Charge you double because you were echoing.
Kaya nga, sorry. I can't seem to figure it out. I'm really sorry.
Sorry about that.
I just had one question or
Go ahead, go ahead.
request from FDA regarding Bowman Technologies and Nika Trading. Both awarded with several bids, even if they were not registered with the FDA. And finally, I'd like to inquire with my chairman if we could call the other members of the team of USECLAO, formerly with DBMPS, Christine Marie Suntay, and Attorney Sami Dagpin, all apparently involved in a mass exodus in June of last year, DBMPS. Thank you, po.
Ordered. The chair directs the Director General to subpoena also these two folks that were identified by the name of Secretary Christine. What is the name, please?
Marie Suntay.
Marie Suntay.
Opo.
And
I think a certain attorney, Sami Dagpin.
Sami
I
Delphin.
believe he's now the chair of the Government Commission on GOCCs. Is that correct? He's still with the government.
He's the head of BCG now. GCG.
GOCC, yeah. GCGOCC.
Yes. So ordered. Thank you.
Thank you
Senator
very much.
Marcos.
Yes, Your Honor.
That's a very hefty interpretation. I just wanted to ask, and we direct the PhilHealth folks to deliver the request of Senator Marcos. Remember, show us the records of who you owe, all the hospitals and everybody you owe. And by the way, hospitals include physicians. Like in the case of Makati Medical Center, you owe them 1.8 million, 180 million in hospital receipts, no, and also about almost 300 million in the form of doctors' fees. So kindly submit those to us from the biggest to the lowest. All right, and of course the matter of people who are you express as fraudulent. We want to see kung talagang fraudulent because I investigated PhilHealth, if you will recall, and there were a lot of fraudulent claims that were not being given attention to. All right, Attorney.
Mr.
We will
Chair,
comply,
Yes,
Mr. Chair,
Attorney Tolentino, you're so ordered. Make sure that Secretary. I'm sure Director General Giran is there, but I'll call him later. Go ahead.
thank you, Mr. Chairman.
Yes.
Just a rejoinder to the answers of Attorney Jim Tolentino to the questions
Yes,
of Madam Marcos, no? Yung tanong na bakit napakadami pong na-file na kaso, no? Alam niyo po, mahal na chairman namin, order po yan ni Presidente when before I sat put at the PhilHealth. Order po niya imbestigahan lahat ng mga kaso. So kaya when I took over, talagang pinaimbestigahan ko yung mga kaso, ano. At saka isa pa, lumabas po sa investigasyon po ng dalawang kapulungan na halos mangilan-ngilan na po mga kaso na i-file ng PhilHealth sa mga supposedly airing authentic partners natin. So that's the reason na I give the order na imbestigahan talaga. Kaya ganun kadami, Madam Amy. And then, yung isa pa po ay because isa pa dyan, talagang napakadami na po ng claimants. Before we came, the average claims per year, Mr. Chairman, was only something like 12 millions claims in a year. Pero at the rate we are going right now, January to July of 2021 po, at the rate we are going, something 14 millions na po ang claims na marireceive namin matatanggap sa PhilHealth. At isa pa, pangatlo po, yung sinasabi po ng ating kagalang-galang po na senadora, na Madam Amy, na in process na 84 billion, hindi po tama yon. Kasi yung sa 84 billions po, ay kasali na po diyan ang pagkwenta ng ating mga healthcare institutions doon sa mga claims na naibalik because of RTH, because of some formal requirements, and those naibalik ng mga kaso because for denied claims. Yung denied claims talaga po, jurisdictional po yan. And yung sinasabi po na yung comment po nating kagalang-galang na senadora, Madam Amy, na ang PhilHealth ang nag-imbestiga, PhilHealth nag-file ng kaso at suspend. Ano po yan? May measure po yan of what we call this due process. Kasi while ang PhilHealth po, mga regions ay nag-imbestiga ng kaso, pero ipapile din yan sa isang ipapile din yan sa prosecution. And then from prosecution po, ipapile din yan sa arbiter. And then from the arbiter po, diretso po yan sa board. So, marami pong dadaanan po. Sa board pa lang po, Mr. Chairman, bago lang akong pumasok sa sa PhilHealth, pero napaka lively po, kuminsan mainit ang talakayan po doon sa board. So, talaga makikita niyo po, Mr. Chairman, na talagang there is due process on this. Salamat po.
Thank you very much, Mr. Chair. I would just like to thank Attorney Gueran. I know him from the NBI to be a competent and upright public servant. Kung sana mabigyan kami ng datos ng PhilHealth upang ipakita at malaman ng ating mga ospital na sumusunod talaga tayo sa proseso. Higit sa lahat na mabayaran na yung mga ospital at kinakailangan natin silang lahat ngayon sa panahon ng ano bang masasabi, pandemonyo. Salamat.
Salamat po, Mr. Chair. Salamat po kay Madam Amy na hindi niya kalimutan si Manong Dante niya. Salamat po.
Thank you, Chair, Mr. Giran. I just want a little bit of housekeeping. Executive Director of PSDBM is required to submit all the DBM records, PSDBM records on the bids that won during bid opening, all bids conducted for Bayanihan 1 and 2. We're displaying it on the wall. The bids that were later on disqualified during post-qualification. 3, all the contracts and notices to proceed they issued pursuant to all the public biddings they conducted under Bayanihan 1 and 2. So you know whether some may have been favored and or whatnot, because there have been a lot of complaints being sent to me. And what was the difference in the prices of the original lowest calculated bid and who eventually won the contracts? So ordered. And also the DBM is also hereby ordered to submit to the committee all documents on negotiated contracts and or bids undertaken for the purchase of PPEs, masks, shields, and all good and or services in relation to the COVID-19 pandemic, including the ones that were mentioned by Senator Lacson, and by Senator Dillon, ventilators and other equipment, including minutes taken, circulars and resolutions and memoranda relative to these acquisitions. We will report in part because this should. I expect that there will be. I've gotten used to that in the Blue Ribbon. I'm about to come out in my report. We report in part so that it can be readily understood and can be intelligible to the public. In the meantime, the next guest is the next senator is the Honorable Pia Cayetano. Senator Pia?
Thank you, Mr. Chair. Thank you. I'll take off from a question previously asked. I think it was Senator Joel Villanueva about the contact tracing. And our Secretary, Secretary Duque, referred to our Stay Safe app, no? Secretary, baka you want to elaborate a little bit because, you know, my understanding of the Stay Safe app is as simple as this. It's an app that stores, restaurants would use. So if people enter, they have a choice to manually log their data, their name, their contact number, etc. Or they can use the app. And that's all it does. It's a digital log of the people who go in and out. Is that the extent of the contact tracing that we're relying upon? Because that's what you mentioned, and actually I've never heard anything else anyway. So that is the contact tracing that we have in place.
I'd like to ask Mr. Chairman if the DICT is around. They should be the best agency to answer this because they're the ones on top of this Stay Safe as the national government contact tracing app. When they presented that to us in March, they showed about 5 or 6 capabilities of the system. So one of which is they'll be able to say how many people a person who enters, say, a store that he got in contact with. Meron siyang ganun eh. I'm not a technical guy on this, and I would like to ask if there's someone who might be able to answer that. The DICT po kasi ang sila po ang talagang nangingibabaw dito. My knowledge is very superficial on this, Mr. Chairman.
The chair would like to know if there's any representative from DICT.
Mr. Chairman, Undersecretary Manny Caintic pala, andyan. Andyan na, sir.
Go ahead, Yusek Kaintek.
Mr. Chairman.
Thank you, Mr. Chair. A short reply lang. I just want to know kung ano yung hindi mahina yung boses mo, sir. I just want to know na tama ba yung intindi ko na all it does, it logs the people who go in and out of that establishment. Does it do more?
Chairman, Senator,
Go ahead.
thank you. Yung stay safe, so yung stay safe po sa present sa amin, required natin sa kanya is supposed to not just do establishment log po, but also to facilitate the recording of the contact tracing done by LGUs. Kaya nga po si DILG at ginagamit ito ngayon at inumuntahi sa mga national government agencies at LGU na gamitin. Subalit po, alam din po natin that various LGUs already have had their own respective bago naging nationally accepted at na-mandate yan ng IATF. Kung kaya also part of the effort is that the IATF is for LGU contact tracing to be consolidated through a central warehouse. Kasalukuyan po namin itong ginagawa na po ngayon with the DILG sa pag-maintain itong central contact tracing warehouse so that the other LGU contact tracing efforts will be across LGUs. Kung sakaling ang isang tao lumipat or bumiyahe from one LGU to another. That is it po. But
Okay.
Madam, Mr.
Okay.
Chair, pagkaka alam po namin, ang Stay Safe, meron din po dapat kakayahan to do a recording of the contact trace, the trace data of the positive patient po, ma'am.
Okay, okay. Mahina yung yung audio nyo. So I'll just repeat very quickly what you said. But basically you said that itong data na ginagather ng mga establishments, dapat na-access to ng mga LGU, and that you are further coordinating with the LGUs because they also have their own facilities. Okay, that's my understanding of your statement. Now, I'll bring you back to the question of Senator Joel, and this is directed again to DOH, but the ICT, take note na rin.
Yes po, ma'am.
The question was not answered
Yes,
because
ma'am.
in truth and in fact, the Stay Safe app is merely a digital log of yung nakasulat sa parang logbook na papel. That's all it does. It's in our imagination that it is interconnected with the national government's tracking system or the local local government's tracking system, because it is not. So all it is a log of who went in and out. Now, who's tracking that? Who's going to alert that establishment if somebody was positive? Who's going to trace back when somebody's positive in the let's say na local government, kung saan siya nagpunta? There is really no one or no system that is doing that. It will now be entirely up to the LGU to determine based on their contact tracing that nagpunta siya sa ganitong store, o sige, tatawag kami sa ganitong store, patingin ng log nyo ng ganitong oras. So that system isn't really in place. That's what I'm saying, Mr. Chair, and that is what I feel that DOH should understand. It's not a matter of being techie or not techie, but accepting the reality that this contact tracing app that you're relying on has limitations on what it can do. And so without people intervening and filling in those gaps, it's not going to do anything for you. It's just a log that individual establishments have. So I want to move on to the next point. I just want to make sure that my point was understood, and at some point give me an answer, because I don't believe you can give me an answer that can give me the confidence I need to know that it's a system that's worked, because that system is not in place. Secretary Duque, would you like to make a quick response? Kasi yun ang intindi ko. So I hope I clarified it for you.
Yeah. I think it's a very limited, no, almost no impact, and but I think the IC team should really make the effort to explain, because ang alam ko po rito nung inadapt na yan ng national government, naka-connect sa atin COVID Kaya, yung data repository system ng DOH. Kasi parang doon nila malalaman sino yung mga nag-positive, di ba? Tapos sino yung mga exposed. So, but it was since March pa eh. The last time we had had an update, no? But
digital log, Mr. Secretary. So I don't want to cut you off. You know me naman, I give all the time to DOH to explain, but I only have a few minutes. So I'll move on to my next point.
we'll echo na lang. We'll echo the concerns, Madam, Mr. Chairman, to the DICT during the next IATF.
Okay, thank you. The next point is also for DOH, no? Hospital bed capacity. I had my staff research, and the bulk of news reports that I've read on hospital bed capacity concerns were raised last year, no? That the hospitals were not being compliant, both public and private, with the requirements set by the DOH guidelines to set aside 30% for COVID patients. I have not seen a report on any specific update that directly addresses that issue. And yet, we keep getting reports issued directly by hospitals saying that full capacity na sila. Well, what is that capacity that they set aside? Did they set aside 30% of their bed capacity so that we know? Because if they did at hindi talaga kaya, then DOH must move on and have an alternative plan. Now, if they did not set aside 30%, then what? I still want to know, what will DOH do about it? Papakiusapan ba yan or papano, di ba? And on that note, on furthering this hospital bed capacity, very quickly lang, can we see, because I do know there is such a report that exists, what are the projections of the need for hospital beds, including ICU, in the next 30 to 60 days? This will be very important considering the limited bed capacity exactly that we have. And your actions will be based on whether that first question I asked is being complied, whether that mandate of 30% is being complied with.
Madam Chair, the report that I came across, the public hospitals are compliant. In fact, hindi lang from 20 to 30%. It's from 30 to 50%. Kasi nga, we need to have more beds to accommodate the rising number of cases. The private sector also has done its part, no? They're supposed to go from 20 to 30%. But
Mr. Secretary,
yes.
I just want to see that report that shows that they've complied, that they're at 30 and 50%. Are you basically reassuring me that all of them are compliant? They are at 30 or 50%, as you mentioned?
Yes, for the public sector, Mr. Chairman. We will send you the report na lang, Mr. Chairman.
Sana Mr. Secretary, if you can have an undersecretary or director dig it up now while I'm asking
Yes.
other questions.
Yeah, with the permission of the chair, Yusek Bong Vega, I believe, has the data on this. Mr. Chairman, kindly recognize Yusek Vega.
Mr. Chairman, this is Yusek Leopoldo Vega of the Department of Health. Can I be recognized?
On behalf of the chair, I'll recognize you.
Vega is recognized.
Thank you, Ma'am Pia, Senator Pia. On the query in the number of or the allocation of beds for private and public, for the whole Philippines, we have already 45% of government hospitals or institutions providing or allocating COVID beds. And for the private sector, it's 25% already has complied in terms of the allocated bed. What is being asked for the private institutions is that they have to go as far as 30% if there is a surge. And they started off with initially last year of only about 12%, Madam Senator. And they have gradually increased their allocated beds to on an average across the country, 25%, Madam Senator. Mr. Chairman.
Kindly submit to the committee the actual compliance, because I have information that even some public hospitals are not providing for the 30%. It can be easily calculated kasi when they say that X number of beds have been set aside, pero alam mo na yung number of beds ng hospital na yon is X number, and you know that is not 20% and or 30%. So just give it to me. I won't take up the rest of the time. I
will do, Mr. Chairman, and Senator Pia, we will do it.
Next point, this is for, well, this again, of course, is for DOH and COA. Chairman Mike Aguinaldo, hello, you're there, no? I'd like to be sure lang that you're listening to this, because this very much includes COA's understanding of the issues. Chairman Mike?
Yes, nandito po, Mr.
Hello.
Chair.
Okay. So, actually, Chairman Mike, before in the last hearing, I already expressed my support for COA to do its mandated duty. You have no issue with me on that. That is your duty. Do not hesitate to do what you have to do. But I also take note that even before the Senate hearing, you mentioned that, you know, given COVID, you know, obviously there would be certain, and I don't even want to say exceptions, you know, we must provide public service and be accountable. We should not lower our standards. But I know what you meant, no? Na parang you'll have your team try to work harder in understanding what are the situations. No, that's my layman's understanding of what you meant. Na okay. And for me, I'd also like to believe that this is not just because of COVID, because the point I want to raise is, and just to put it bluntly, no, I won't mince words anymore. A lack of understanding on the part of not just COA but even other persons involved in what it takes to deliver healthcare. So, as you know, I chair the budget hearings of the Committee on Finance for Health, and I chaired the Committee on Health for 10 years. Thus, despite not being a doctor, pareho tayong abogado, I'd like to believe that my understanding in this area is probably deeper than the average person. So experts tell us, and these are universal healthcare advocates, no, primary healthcare advocates, tell us that one of the biggest problems we have is that PhilHealth is meant to be an insurance company. It's meant to insure people against health disasters, iwas sakit, okay? So we cannot set up PhilHealth as it is currently sadly set up as a reimbursement mechanism, which is what it is. So I'll give you an example of a program that should have been rolled out sooner than later, and it still hasn't been rolled out. And at the rate PhilHealth is going, I fear that it won't roll out. It's the Consulta package. Upon consultation with COA, PhilHealth has pegged the Consulta package. 40% is for the benefit of the general public who doesn't understand this, no, supposed to be the way this outpatient care will be given. And I've been waiting for 15 years for this package to be rolled out, because we all know primary healthcare begins at home, in the community, diba? Pag dumating ka na sa ospital, malala na sakit mo, medyo huli na tayo. We want to take care of them pag hindi pa malala yung sakit. So basically, you're giving the community doctor or the community healthcare system X amount to take care of the whole community. Now, the way the Consulta package is currently set up is that 40% of that is given to the doctor for basically advising the patient, and doctors will tell you that by looking at them, they can already, and asking questions, they can tell them what their immediate step should be without having to order lab exams, etc. Any good doctor knows that. However, 60% of the package is reimbursable only if they do lab exams and the like. And that's something that we need to revisit, because if you put a cap on the lab tests that people can get, number one, it is an initiative for doctors to order that lab test, even though by sight, they can already tell you na, stress ka pala, nanay, tapos magkakaroon ka na pala, baka dysmenorrhea yan. They can say that without having this woman go through a sonogram, whatever. But if you put a cap there, napipilitan sila to have a test. Meanwhile, that cap is so small for other people who would need a test that's equivalent to, let's say, 5,000 or 10,000 pesos. You and I know that MRIs are like 15,000, 30,000. Wala na. They cannot avail because the cap is 500 pesos total, or 750, whatever it is, and 60% goes to that. So my point, Mr. Chair, is that can I get your commitment that let's work with DOH on these issues? I have no issues on graft and corruption, do your job. Pero on moving towards the delivery of healthcare, hindi ito pwede reimbursement based on lab tests and the like. Do you agree?
Yes, Mr. Chair, we wholeheartedly agree. As you know, we were involved in one of the investigations on PhilHealth, and our focus wasn't only on looking for graft and corruption, but looking at ways to improve their processes. Yung Consulta system nga po, we noticed that because one of the problems PhilHealth faces is yung upcasing, no, where konting ubo lang, sasabihin pneumonia, tapos hospital and all that, no. But we found out that there are some cases na you would say hindi naman talaga fraudulent yung intent. Ang nangyari, matanda na umuubo, ang sabi, uminom ka lang ng gamot, wala naman siyang pambili ng gamot. So ang ginagawa ng doktor, medyo sasabihin niya it's something more so that maging libre yung ano. So maganda po sana if a system can be established like yung konsulta po to address that. Now, itong caps, it's similar to the case rate system that you find in PhilHealth, and we did a performance audit on that. Yung case rate system naman on its own, hindi naman masama yun. The problem was, I think, dahil sa dami ng case rates, I think you're looking at, if I'm not mistaken, over 20,000 case rates. The whole idea of case rates is you do a periodic review. Titingnan mo ngayon, is it receptive? So meron kasi dyan, yung case rate mas mataas sa actual, i-adjust mo ngayon yan. Meron naman yung case rate, sobrang baba dun sa actual, medyo adjust mo rin pataas naman yung case rate doon. So it's sort of balancing and harmonizing it. The problem I think is dahil sa dami, hindi nagagawa because there are just too many. Medyo naging unwieldy. So we weren't saying that the case rate was evil, nothing to that extent. No? Ang sinasabi lang natin, it became too unwieldy. And so sana magawa ng paraan. But to answer your question, Mr. Chair, 100% we are very willing to work with DOH and PhilHealth on this. We think that health issues are one of the most important issues when it comes to the Filipino people. In fact, ang sinasabi ko dyan, sa government, yung problema is pag may nagkasakit, mangungutang, tapos tuloy-tuloy na yan. Baon na sa utang parate because hindi na niya mababawi yung sakit. So, the universal healthcare, and if we can answer really all of these healthcare issues for the people, I think that's really the most important thing. So you do have our commitment, Mr. Chair.
Mr. Chair, I'll take this up more in the even pre-budget.
Pia, can you wrap up, please? Because your
Sir,
time is...
I'll post my questions and I'll just ask the agencies to give us a response in writing. Chairman Aguinaldo, salamat. I'll talk with you some more, no? I just want to make public that concern, and then I'll talk to you more before the budget season begins. My other
You
concern,
right, Senator Cayetano, you want the agencies to answer you in writing?
yes,
reply
my
to your-
well, because there's no time, so
So you
office, they can also call my office, but to share my concerns with the others, I'm happy if they write to us what their response will be. I'll post my questions now very quickly. On the vaccine passport, Senator Grace and I have been advocating this. We both have filed bills. May we know from DOH on how they intend to proceed, because as more and more people get vaccinated, it would ease the recovery of the economy if people can safely go out and go to places. So I'd like your views on that. And then DOH, and I don't know if DOST is here, but can we find out if we are aggressively pursuing self-sufficiency when it comes to vaccine testing kits? Your Honor, the chair is an advocate here, and as His Honor said, the vaccine to get the vaccines, it takes a while because there's a long waiting list. So we have to test. Self-sufficiency. Are we encouraging investors to come up with this, or to come up with plants where we can make our own here, do JVs with other companies, and yeah, that's it, Mr. Chair. I just want to tie in that need for testing to the other hearing that's going on simultaneously under the committee of Senator Gatchalian, the Committee on Education, wherein we are talking about the return to school. We are one of 14 countries in the whole world that has never sent our kids back to school. And Secretary, may I ask you to assign a high-level person to work with DepEd on this, because it's crazy, no? I mean, obviously the timing right now is not best, but really all over the world they're talking about kids continuing schooling in mask, and here we are, our kids have never gone back to school. So we need DOH to be more proactive in working with DepEd on this. And to say that they have not been, I think, is an understatement, because COCOPEA, which is the largest association of private schools, have never even been consulted by DepEd on their suggestions and recommendations on a safe back to school face-to-face program. So I rest my case. I leave it at that. Kindly give us the response in writing, or you can also call my office. Thank you very much, Mr. Chair.
We'll do that, Madam, Mr. Chairman. Thank you.
points well taken, especially on the matter of education. We're losing very, very badly here, and these last 2 years has been disastrous to our educational system. Not to mention the fact that our educational system has been rendered backward. Matagal na yan. So, kailangan iayos natin yan. Let me just call on Senator Ontiveros. It's your turn. Senator Ontiveros, are you there? Senator Lacson? Senator Ontiveros, are you there? Senator Lacson? We're almost nearing kasi the session na. Senator Angara?
Mr. Chairman.
Yes, who's that? The Senator Lacson?
Yes.
Good. I know that you're locked up in your room.
Yeah.
You can run,
Anyway,
but you can't hide.
Thank you for recognizing me. I have a few issues to take up today. The first issue that I'd like to tackle concerns the DBM, because this. Okay, I have a slide, that states the DOH financial highlights, and I'd like to ask the DBM to explain this, because a look at this slide will show a continuing appropriation in the amount of 15 billion 371,631,000 pesos under specific budget, CONAP, continuing appropriation for 2020. However, when this item was listed, this time in sub-item B, allotments, the amount became 12 billion 179,343,000. Same item, specific budget, continuing appropriations. So resulting in a discrepancy of more than 3 billion, 3.19 billion in fact. Now, unlike the other items described as CONAP, namely automatic appropriations and special purpose fund, nabawasan po ito ng 3 billion mahigit. So, we'd like,
Yes, sir.
yeah, should not the same amount of 15 billion plus be reflected in sub-item B, allotments, instead of 12 billion? So, ano yung reason for the discrepancy and where did it go? DBM, please.
Mr. Chair, initially, my analysis here is that teka sir ha, pinag-aaralan ko lang po sir, sandali lang po.
Kasi pag sinabi natin continuing appropriations, continuing, so ba't nabawasan?
Sir,
Dapat carried over yan.
Sir, hindi. Kasi it does not necessarily follow na yung leftover appropriation will be carried over. There will be certain items that will not be carried over the next year. So there might be, that is the reason why mas mababa siya the next year. Ganun po yun.
I've been participating in budget deliberations. Ang pagkaalam ko, but of course, I may be wrong, but ito yung customarily nakikita natin. Pag sinabi natin continuing appropriations, it's continuing appropriations. And having said that, since you mentioned that hindi naman lahat ng items nakikerry, we would like to find out what are the items that have not been carried over to sub-item B, allotments. At saka ano yung mga nasakripisyo, in terms of the priority programs, activities, and projects ng DOH, ano yung sinacrifice nyo?
Sir, Your Honor, ako po bang?
Yes, still DBM.
Yes,
And
sir.
also, DOH, if they know the answer, ano ba yung nabawas na nawala sa kanilang mga programa na hindi isinama doon sa continuing appropriations?
Yun sir, kung ano yung mga hindi na carry over, I think DOH would be in a better position to explain what items they actually did not continue under yung continuing appropriation nila, which they call CONAP.
Yes, DOH, please.
Yes, thank you, Mr. Chairman. Kindly recognize, please, Director Rowena Laura, the Finance Director of the DOH, Mr. Chairman.
Yes.
Director Weng Laura, please.
Yes, Mr. Chair, Your Honor. Regarding the year-end 2020 unobligated allotment of the DOH, ang total po talaga niya is 24.6 billion. However po, out of the 24.6 billion, only 17.4 billion will be considered as continuing appropriation. 7.1 billion of which po is hindi na nga po magiging continuing appropriation since lapse po ito. Example po nito, sir, yung foreign loans po. Lapse po ito, hindi po siya naging part of continuing appropriation. Same with po,
Excuse me, Undersecretary. Iba yon ha. Pag sinabi nating loans, nasa, I believe, nasa unprogrammed yun. Ano?
Yes.
Or
tama, sir.
Tama yun.
automatic appropriations, pareho na carry over, same amount. Pati yung special purpose fund, which is an allocation or appropriation to augment the regular budget. At tinatanong ko lang yung specific budget amounting to 15 billion na nabawasan ng 3 billion. As we can see also on the slide, ano, yung sa 2019, di ba, ang continuing appropriation niya, 6.8 billion. So, nagkaroon ng siya ng increase sa continuing appropriation sa CONAP ng 15 billion kasi na-carry over pa rin yung kasi mayroong increase na 8.5 billion. Kindly enlighten us, Undersecretary.
Or, Mr. Chair, yung hawak po namin kasing data ngayon is already confirmed na po to sa DBM during our last reconciliation po kung ano po yung naging CONAP and ang naging lapse. So if you will allow us po, we will try to send our data today po para po ma-reconcile itong figures po ng disparity, Your Honor, Mr.
Alright.
Chair.
We also ask COA, ano, kasi sila naman ang nag-flag nito.
Yes po.
Ng computation na tumama do sa difference na 3.192 billion. Sinabi nila under General Administration and Support, Personal Services under Administration of Personal Benefits, 3.051 billion. Now, operation, capital outlay under Health Facilities Enhancement Program, 0.103 billion or 103 million. MOE under Pharmaceutical Management, 0.009 billion. Personal Services under Operation of Dangerous Drugs Abuse Treatment, 0.029 billion. So ito yung mga nasacrifice na mga programs ng DOH. And if we sum this all up, aabot talaga siya ng yung difference na tinitingnan. Kindly cross-check kung tama itong mga programs na nawala sa DOH and why were these programs chosen to be deleted under CONAP?
We'll do that, Your Honor, Mr. Chair. Salamat po.
Okay, sige, utang ha.
Utang po. Salamat po.
Sige. Anyway, next point, next issue. Now, during the Commission on Appointments hearing, and I would like to address this to Secretary Duque, on the appointment, on your appointment as a head of the agency, the DOH, I ask you, I remember this, I raised the issue on the agency supply chain of medicines, since there have been reports of wastage due to overstocking and expiration of drugs and medicine. Ito po yung transcript na ipapakita natin sa screen. Maliwanag po, nag-commit kayo noon. Transcript of records show that Secretary Duque committed in prioritizing the procurement and disposition of supplies to avoid unutilized and idle inventories. Ito po yung sinabi niyo, Secretary. We will do that. It's been my priority. This was last February of 2018 when you faced us, because I was a member of the Commission on Appointments at the time. I still am, Your Honor, because I will not allow it. Your Honors, that we have overstocking of medicines, and then you added pa. Under my watch, we will not allow this. Your Honor, so we'll make sure that proper systems are in place. The logistics and supply chain reforms must be put in place ASAP, Your Honor. So what happened, Secretary Duque? Kasi ito na ngayon, papakita ko yung next slide. nagkaroon ng overstocking of drugs and medicines, ano. And in the spirit of fairness, I went back further. Hindi lang yung para wag niyo naman sabihin na parang pino-focus ko lang doon sa under your administration since 2018. Bumalik po ako rito hanggang 2013, as a matter of fact. And we can see in this slide, kindly plus the next slide, overstocking of drugs and medicines. Okay, 2013, 4.442 million. 2014, 6.851 million. 2015, and so forth and so on. Andiyan naman sa slide. Ano? Ito, meron siyang breakdown. And this came from COA. Because hindi lang yung 2020 COA report ang tiningnan namin dito. Ibinalik ko pa yung, just to highlight the point that these are recurring issues. Ano? Hindi lamang sa panahon ni Pangulong Duterte, hindi lang sa panahon ni Secretary Duque bilang DOH Secretary, pero recurring ito eh. At saka ang laki na nasasayang, imagine, for the past how many years? 8 years, ano? 2013 hanggang 2020. Ang tinapon nating pera, 2,736,428,600 pesos and 98 centavos. Hindi ba nakakapanghinayang ito? At ang daming walang gamot, lalo sa mga barangays. So what's the reason for this? Ano? Why are we overstocking? Why are we buying nearly or nearing expiration ng mga gamot, no? Na nag-expire tuloy? So andyan din yung breakdown. So what does this tell us? No? Sa akin, because I've been an investigator all my life, ang ini-indicate sa akin ito is probably, and this is not, I'm saying not possibly, but probably, merong mafia na well-entrenched, na hindi nabubuwag, hindi na-uproot, hindi na-extract, nandyan, nananatili sa DOH. Pwedeng nag-retire na yung iba, pero pinalitan ng natutong bagong miyembro ng mafia. And unless the secretary or the leadership of the DOH will really put his foot down and do something about this, hindi matatapos itong overstocking ng gamot. I'm sure if I go a bit more or a bit further pa, I'm sure lalabas pa rin itong mga overstocking na ito. And year in and year out, we are wasting hundreds of millions of pesos. Ayan na nga, from 2013, 2.736. Now, Secretary Duque, anong gagawin natin dito? What are the factors contributing to this? Ano? Pardon my assumption or my conclusion. Ano? But I think it makes sense to think na meron talagang mafia involved in the procurement of drugs and medicines. Because for the life of me, I cannot understand bakit ay bibili ng malapit na mag-expire na gamot. May suki ba tayong malapit na mag-expire na gamot? Yun ang binibilhan natin lagi. At yun ang, or yun ang nananalo sa bidding. Kindly enlighten us, Secretary Duque.
Thank you, Mr. Chairman. Ito pong binanggit ninyo, yung kasing meron tayong standards kung halimbawa may gamot na dapat 18 to 24 months. Hindi ko lang po hawak, no? Pero may standards po tayo na inihanda ito ng program at saka, in fact, even FDA. Hindi ka pwedeng bumili ng mga near expiring drugs and medicines. So siguro yung near expiry dito po na nakikita natin, baka hindi lang siya gumalaw kaagad at lumapit na doon sa kanyang expiration. Pero siguro mas maganda po, with your permission, Mr. Chairman, yung aking USEC sa procurement supply chain, ito po, ang alam ko, meron na po siyang programa dito para ito ay maibsan. Yung reforms na ginagawa natin, Mr. Chairman, halimbawa sa governance, meron na po tayong Supply Chain Management Office, yung development of the National Procurement and Supply Chain Management Strategic Plan. Tapos meron din tayo yung updating of the Warehouse Operations Manual, yung development of forms and improvement of processes on notification, shipping list and bundling of essential health commodities.
With all due respect,
Yes, ma'am. Yes, sir.
I think ang better approach dito is a thorough scrutiny of the department or the unit under DOH that's in charge of procuring drugs and medicines. Instead of, the theoretical or the usual highfalutin words describing how to go about it. Ako, tingin ko rito kasi well-entrenched imagine. At saka itong nearing expired, overstock, hindi po sa akin galing ito, sa COA ito. And COA, sila yung nasa ground, yung mga resident COA and COA investigators, were the ones who found out or discovered ito mga nearing expired. Pag sinabi nating nearing expiry, hindi pwede yung matagal pang mag-expire pero naging idle lang. No? Kasi iba yung expired. Imagine magkano lahat yan na expired na yan. Pag inalis natin yung overstock at saka yung nearing expiry. Yung expired, ito yung talagang wastage. And wastage of public funds. Now, hindi ba mas maganda po na pag-aralan natin mabuti unless, and I don't want to believe that you have been co-opted, because
Thank
I
you,
don't
sir. Thank you, sir.
believe that. No? So, if I may
Salamat
suggest,
po.
I think an investigation is in order. To
Okay,
find
sir.
bakit lagi na lang ganito yung ating pagbili o pag-procure ng drugs and medicines. Imagine, 2.7. Pag bumalik pa tayo ng another 8 years, baka umabot na ito ng 5 billion. And nag-commit po kayo ng 2018, February 7, when you faced us in the Commission on Appointments. Pero 2019, lumobo, naging 2.2 billion yung overstock, expired sa nearing expiry. Hindi po dapat, di ba dapat hindi na COA ang magre-raise ng red flag dito? Dapat kayo na.
Yes, sir.
2019, a year after you committed during the confirmation hearings, lumobo pa siya ng 2.2 billion. So kung ako yung, of course, theoretical ito, no? Kung ako yung nasa posisyon, gagawin ko agad. Titingnan ko, may mafia ba rito? Bakit taon-taon ganito hindi nagbabago? These are recurring issues involving drugs and medicine. Now,
Yes, sir. Yes, sir. Magpapaimbestiga po ako nito.
Yes.
Lalo na yung sinabi ninyo na yung may mafia. Kailangan talaga itong...
Kung ako yung mag-iisip, yun lang iisipin ko kasi recurring. Sana kung isang taon lang tapos nawala, maaaring kapabayaan lang. Pero pattern na po ito Secretary. So please.
Yes, sir.
Now,
We will do that, sir. Yes, sir.
Issue, I will fast track this. Yung deficiencies on management of HPEP equipment. Ito po, mas malaki ito. 4 billion plus over a period of 7 years. From 2014, andyan din sa slide. Can they show this slide? Itong HPEP, ito yung banner programs, one of the banner programs under the Aquino administration kasi nagsimula ito 2014. For the upgrading of health facilities and providing training to health professionals to improve the access of people to quality health care. Yeah, the proper implementation of this program would have been beneficial to our response to this pandemic, especially now, mayroong pandemic. Now, ako, ito, matter of record, I supported the SPEP of DOH in terms of my institutional budget amendments kasi pag nag-amend ako, it's always institutional. As I believe that this is an integral part of our universal healthcare system. Crucial ito sa efforts natin to respond to the health crisis. For the 2020 budget alone, I propose an increase in the amount of 1 billion pesos. In 2021, nag-propose na naman ako ng increase na 8.68 billion. Sinusuportahan naman po ito ng mga kasamahan ko kasi alam nila na importante yung compliance sa universal healthcare. Pero pag nakita natin yung lapses in the implementation, ito, COA report din ito, through the years, in 2020 alone, equipment in the aggregate amount of 1.2 billion procured under HPEP were found to be either undelivered, unutilized, and without calibration and preventive maintenance. So sayang na naman yung pera ng bayan dito, Secretary. What can you say? Please, Secretary Duque.
Mr. Chairman, can you hear me?
Yes, I can hear you.
Magagamit pa naman ho ito, Mr. Chairman, i-recalibrate lang para nang sa ganon makatulong sa atin mga diagnostics sa mga DOH retained hospitals. We have about 76 74 retained hospitals. So papacheck ko po ito kaagad kung ano ang naging estado nitong mga makinang ito. I will order the regional directors to give me a report on the wherewithal of all of these equipment amounting to in 2020 1.2, in 2019 716 million, and so forth down the line. So titingnan ko po baka naman ito ay masalba pa ito at siguraduhin lang na makuha ko yung report at ano yung mga recalibration efforts na dapat gawin to make them functional if they're not yet functional, Mr. Chairman.
Thank you po. Hindi ito usapin ng corruption, usapin po ito ng inefficiency.
Yes, sir. I agree, sir. I do agree, sir. Masakit po ito na ganito po.
For that matter, can you just give us a detailed inventory of all HPEP facilities in the country that are actually serving the intended purpose of the program?
We will do, sir. We will do, sir.
Pati mga deficient?
Yes, sir. Lahat na po ng inventory, yung functional, yung deficient or already I don't know what the term is, yung hindi na po magamit at gano'n na katagal itong mga makina na ito.
Pakilistan nyo lang lahat yung utang.
Please wrap up.
Yes, sir. We will do, sir.
Ito another issue, yung deficiency or deficiencies in the management of HPEP infrastructure projects. Ito malaki.
Saan nakalabas siya?
8.5 billion pesos. So isama nyo na rin ito. So ang
yes, sir.
Rito, we're depriving the public of the benefits that they could have derived from the immediate and maximum use of these facilities. Hindi ba? Kasi kung mga deficiencies, medyo nasi-shortchange natin yung, sabi natin yung customers ninyo, yung clientele, the public. Kasi alam nyo, yung health napaka-importante, hindi po ba sa ating bansa, sa ating mga kababayan. Tapos makakakita tayo ng 18.5 billion or almost 18.6 billion na mga deficient at saka inadequate yung serbisyong binibigay. So another utang, Secretary?
Yes, sir. Itong management of HPEP infrastructure projects, magpapagawa ako ng inventaryo ng lahat ng mga kontrata nito at tingnan ko kung bakit hindi natapos at ano kaya ang mga circumstances. Dahil, so I will have all the contracts reviewed, Mr. Chairman, Your Honor.
Maraming salamat po, Secretary. Now,
Senator Ping,
yes.
We're being told by the Senate President that we must finish by 2:30. So actually, your time is up, but I'll give you time to wrap up.
Sige, last point, ito sa round. Pero sige, Mr. Chairman, if you want to, para makapag-prepare din tayo sa session, but ito na muna, last point on this issue. Ito, another point of concern is the disbursement of various DOH, ito, lahatan na ito, various DOH operating units that did not comply with established rules, procedural guidelines, policies, principles or practices. Ano? Alam nyo, ito binabantayan ng COA lagi. Irregular, unnecessary, and excessive expenditures. Pag nakakita sila ng ganyan, either one of the three, talagang red flag ka agad yan. Tama po ba yan, Chairman Mike?
That's part of the compliance audit that's done together with the annual audit.
Basta nakakita kayo ng irregular, excessive, saka unnecessary, red flag na agad. So, ito, 956 million pesos, no? Starting from 2016 hanggang 2020. Can you, DOH, anyway, we don't have time anymore. Can you elaborate? Pakisama nyo na rin sa i-report nyo ito sa amin, Secretary.
Certainly, Mr. Chairman. So, Ang akin pong marching order sa mga implementing units ay magpadala sila kaagad ng kanilang mga paliwanag dito sa mga irregular, unnecessary, and excessive expenditures. Kung ito ba ay lumalabag sa ating pong mga panuntunan at posibleng humantong ito sa mga notice of disallowances later on. But I would like to correct this even before it reaches
Yes.
that stage of the investigation by COA, that is. So gagawin ko na lang po ito, Mr. Chairman, na titingnan ko kung ano yung mga rejoinder, bakit nagkaroon ng ganito, at kailangan ito po ay matugunan ng malinaw, bakit nangyari, ano ang gagawin nila. Alam naman po nila yung kanilang pananagutan dito sa mga observations ng COA. Yun lang po, Mr. Chairman.
Pwede silang humarap ng sa ombudsman dito kasi pagka nagkaroon ng notice of disallowance o kaya nagkaroon ng technical malversation and so forth and so on, medyo baka may pagkalalagyan. So anyway, Mr. Chairman, I have many questions more addressed to Undersecretary Laos, but since we lack the material time, we have a session at 3 o'clock. I will suspend my interpellation and hopefully next time that you resume the hearing or the inquiry, baka pwedeng we take off from we left off. Kung sino yung huling natapos, baka ako yung pwede magsimula. Kasi I've been here this morning, alam nyo,
I know, all of us have been here.
nag-log in ako at 9:30 thinking na maaga ako. Yung pala, si Senator Amy, 8:34 naka-log in na. So naging number 9 ako sa list. So thank you, Mr. Chairman. That's all for now.
Thank you. If we were short on that, I apologize, but I was just given the list by my staff on who came in. But thank you for your questions. They're very precise. I have two quick questions lang para kasi it's no point investigating and DOH is like a target that we're hitting based on the COA report. But really, one of our intentions principally is to make sure that they're able to vaccinate and be able to test so that we know who what needs to be done because we have to get rid of COVID. We have to beat COVID. And so the next hearing, we will concentrate on that along with the discrepancies and the irregularities. So I'd like to tell everybody, with the permission of everybody, I don't want this to lag. I would like to call the next meeting on Friday para hindi tatagal. Kasi tomorrow I would have wanted to do that, but House of Representatives have their own hearing. So I have a JBC on Friday, but I will be able to get out, I suppose, by 1:30. And by 1:30, we should be able to start and up to the wee hours of the next morning, if we need be. We've done that before. But we will call everyone and we will all have a chance to find out from Undersecretary Lau many of the things that we have laid the predicate on. I assume, Secretary Duque, that you've already submitted the matters that we wanted to be submitted to us. Have you done that?
Yes, sir. In fact, I have a report that of the documents requested, out of 19, we have already submitted 16 for an 84% compliance, and then ongoing is 3. Sir, of course, this list goes on because we have a new request in today's meeting. So we will act on this very quickly, Your Honor.
Director General of the Blue Ribbon Committee is supposed to receive them, and I have not been given the information. But after tonight, I suppose we'll be able to check on them and be able to pursue the investigation in a more cogent manner. Right now, it's kind of everybody has to ask their questions, but I try very much to make sure that we're focused, that we don't stray from the path, and not to give our friends in the executive a very, very hard time. Because that is not our intention. Our intention is to seek the truth and to make sure that we balance out serving our country more than uh, dramatically than serving it in a very least way. So, with the permission of everybody, I will call the hearing on 1:30 at 1:30 on August 27th at 1:30 p.m. If that's okay with everybody, I will now suspend the hearing. But before you do that, I just want a quick question to Secretary Duque. How many vaccinators do you need to complete the vaccination? Of course, you'll always need them, even if they've been vaccinated already. Are we going to have booster shots? When are we going to have booster shots for the 12-year-olds going up so that many of them can go back to school as well? Would we be in the right direction if we ask those questions later on from the standpoint of the aims and purposes of DOH?
Yes, certainly. For the next meeting, we will answer these questions. I've taken down notes on what you have said. But right now, for the vaccination program, we have requested for 4,800 additional vaccinators. And our goal is to jab or inoculate 500 to about 700,000 per day, supply permitting. And if we are able to do that, then we should be able to reach herd immunity with second dose, of course, no, sir. Probably mid first month or second month of first quarter next year.
In second quarter of 2022, just in time for the elections.
Quarter, sir. First quarter. Mga second month of
It
first
sounds like
quarter.
we're aiming for the election. So anyway, but the important thing is, are you able to get 700,000 a day? How many are you able to get right now?
400,000 a day. There were days when we were able to log in about 650. The highest was 700,000. So in terms of efficiency, kaya naman po. Yun lang
Okay.
talaga sa supply lang, sir, na nalilimitahan na tayo. Salamat
Okay.
po.
And finally, can you give us a reading talaga?
Chair.
Yung testing has always been questioned. I really feel that dapat malinaw sa tao na libre ang test na binabayaran dapat ng PhilHealth yan. Di ba correct yun?
Yes, Your Honor, certainly. Our testing capacity naman is about 101,808 tests per day. So we should be able to maximize this, Your Honor, Mr. Chairman.
Yes. Now, the question is, para magpa-test na nga yung mga tao, alam nila sagot ng gobyerno yung kanilang test para lahat makakaagwanta, no? Dahil kung hindi, naandyan yan. Sagot ko nga doon sa iba, nalalaman natin kung anong rate natin by testing. Katulad yan, ano ba kahapon? 18,000 kahapon, di ba? Ay ngayon, ano ba maabot ngayon? Tumataas pa?
Kahapon po, we have 12,300 plus cases, if you are asking for the number of cases.
Yes,
The
yes,
other
yes.
day was 18,000, sir.
Yes, that's right. And do you see that increasing pa?
Well, it's hard to say, but based on our projections, mukhang tataas pa rin ito because the 2-week ECQ results will only be seen perhaps beginning September 4 or second week of September.
All right.
Mr. Chair.
Okay. On that note,
Mr. Chair.
Senator
Angara, Mr. Chair.
I want you to know that the Senate President has already
Yes, Mr. Chair.
admonished
I'm
me
not
that we
going
should
to-
finish by
I
2:30.
was
Go
just
ahead.
going to ask Mr. Chair, as a procedural matter, would it be possible to pick up where the list of questioners today? So meaning,
Yes.
I think Senator Hontiveros is next, and then I think Senator Poe, and then myself. So could we still follow that order for Friday's hearing? Just a respectful
Yes,
request.
we'll do that.
Your Honor.
We'll do that.
Thank you, Mr.
Thank you,
Chair.
Mr. Chair. Thank you, Senator Sani.
All right.
Thanks,
Okay. Great. So on that note, this session is suspended until 27 August 2021 at 1:30 p.m. We'll see you there. And everybody is on notice that they're still invited and they've been called, and those who have been subpoenaed must come. And I think there will be more focus now on the very, very hard issues that have to be explained. Thank you very much. Session
Thank you,
is
Mr.
suspended.
Chair.
Thank you, Mr. Chairman, in behalf of the DOH. Thank you, sir. Thank you, Your Honor.
Thank you. Thank you very much.
Thank you, Mr. Chair.
Thank you very much.
Thank you, Mr.